I know you're worried. I know you're scared. I know you're discouraged. I know you're confused. And I know you're tired. You've studied hard for years. From the day you registered for JAM, you had a dream. Maybe it was medicine, maybe nursing, maybe pharmacy. Like many others, you were driven by a genuine passion for healthcare and a desire to care for people. But somewhere along the journey, things didn't go exactly as planned. Maybe your score wasn't enough for your preferred course. Maybe your university offered you physiology, anatomy, medical biochemistry, or another basic medical science program instead. For some students, the change happened automatically. For others, it was a difficult decision they had to make in order to gain admission. Then you entered the university environment. You found yourself in the College of Health Sciences, surrounded by students from medicine, nursing, pharmacy, and other professional programs. Sometimes, intentionally or unintentionally, they made you feel less important. Some looked down on your course, some questioned its value. As a physiology student, you've probably heard statements like, medical students already learn everything physiologists learn. Why spend 4 years studying something doctors have already covered? It's just a stepping stone. Over time, those comments begin to affect you. You start wondering if you've wasted your years. You start questioning your future. You start asking yourself whether your degree will ever be valuable. If you've ever felt that way, this video is for you. Stay with me as we walk this journey together, because today I'm going to show you who you really are, what you're capable of becoming, and the incredible opportunities that exist within physiology that many students never discover. The truth is that most universities teach the academic content of physiology, but very few teach students how to translate that knowledge into a successful career. They teach the science, but they rarely teach the possibilities. And that is one of the reasons many graduates of physiology, anatomy, and other basic medical sciences leave school feeling uncertain about their future. But that uncertainty doesn't come from a lack of opportunity, it comes from a lack of awareness. So let's begin with the most important question: who are you? First and foremost, you are a medical scientist. You are part of the foundation upon which modern healthcare is built. As a physiologist, you study how the human body functions under normal conditions. You understand how organs communicate, how systems interact, and how the body maintains balance. You know what is normal. And because you know what is normal, you can recognize when something is abnormal. That knowledge may sound simple, but it is incredibly powerful. Understanding normal body function is the starting point for diagnosing disease, monitoring patients, conducting research, developing treatments, and advancing healthcare. Your knowledge gives you a unique advantage that can be applied in clinical practice, diagnostics, research, academia, healthcare technology, and many other sectors. Now let's talk about what you can become. I'm speaking not from theory, but from experience. Across Nigeria and around the world, thousands of physiologists are building successful careers. Many are involved in clinical services, emergency care support, cardiovascular diagnostics, research, healthcare management, academia, medical technology, and specialized healthcare professions. Many of them earn excellent incomes. Many have rewarding careers. Many are making significant contributions to healthcare and scientific advancement. And interestingly, some have found opportunities that provide greater flexibility, lower stress, and higher professional satisfaction than the careers they originally dreamed about. One of the most exciting aspects of physiology is specialization. Since physiology studies the functions of different systems of the body, physiologists can develop expertise in specific areas. One of these areas is cardiovascular physiology. Cardiovascular physiologists focus on the heart and blood vessels. They study how the heart pumps blood, how circulation is maintained, how electrical signals regulate heart rhythm, and how cardiovascular diseases affect normal function. These professionals play important roles in cardiac diagnostics, patient assessment, cardiovascular testing, and heart-related research. Their expertise helps physicians make accurate decisions about patient care. In recent years, another exciting opportunity has emerged for physiologists: echocardiography. Echocardiography involves the use of ultrasound technology to examine the heart in real time. It allows healthcare professionals to assess heart structure, blood flow, valve function, and overall cardiac performance without surgery or invasive procedures. Specialized training, physiologists can become certified echocardiographers and work alongside cardiologists in hospitals, diagnostic centers, and specialized cardiac facilities. In Nigeria, one of the recognized training pathways is through the Lagos Echocardiography School, where eligible healthcare professionals, including physiologists and radiographers, can undergo advanced training in cardiac ultrasound and echocardiography. There are also other training centers and institutions that continue to expand opportunities for physiologists seeking careers in cardiovascular diagnostics and cardiac imaging. Another training pathway available to physiologists is echocardiography. Apart from larger training centers, there are institutions such as Clio Clinic in Uyo that provide hands-on training in echocardiography. Through structured theoretical and practical sessions, trainees learn how to perform cardiac ultrasound examinations, interpret findings, and contribute to clinical decision-making involving cardiovascular health. Another exciting opportunity is becoming a dialysis technician. Several teaching hospitals across Nigeria offer dialysis training programs where healthcare professionals learn the principles of kidney replacement therapy, operation of dialysis machines, patient monitoring, and the management of routine dialysis procedures. For physiologists who are passionate about cardiovascular medicine, there is also the pathway of becoming a cardiac physiologist. Cardiac physiologists specialize in diagnostic procedures such as electrocardiography, ECG, Holter monitoring, exercise stress testing, cardiac function assessment, and other investigations used in evaluating heart health. They play an important role in supporting cardiologists and improving patient outcomes. Beyond the cardiovascular system, physiologists can also specialize in respiratory physiology. Respiratory physiologists focus on the lungs and breathing mechanisms. They perform and interpret tests such as spirometry, lung function assessments, and other diagnostic procedures used in the evaluation of asthma, chronic respiratory diseases, and various pulmonary disorders. Globally, respiratory care and respiratory therapy continue to be among the fastest-growing healthcare professions, creating exciting opportunities for physiologists who choose this path. To become highly skilled in any of these specialties, postgraduate education and professional training are often important steps. Through master's degrees, certifications, workshops, and clinical attachments, physiologists can develop expertise in specific organ systems and become valuable members of multidisciplinary healthcare teams. Today, several professional organizations and regulatory bodies are working to support physiologists by providing guidance, training opportunities, professional development programs, and career direction like the Professional Association of Practicing Clinical Physiologists in Nigeria, PAPCPN. The opportunities within physiology extend far beyond what many students imagine. Some physiologists work in clinical practice, some work in research laboratories, some contribute to reproductive medicine and assisted reproductive technologies, including in vitro fertilization. Some become healthcare entrepreneurs, establishing diagnostic centers, consulting services, and medical equipment businesses. Others pursue academic careers and become experts in specific areas of human physiology. The possibilities are extensive, however, success requires initiative. As I mentioned earlier, universities provide the foundation, but students must take responsibility for building upon that foundation. The most successful physiologists are often those who continuously learn, seek additional training, build professional networks, and remain open to emerging opportunities. That is why I encourage every physiology student and graduate to connect with professionals in the field. Use platforms like LinkedIn. Reach out to physiologists working in clinical practice, research, diagnostics, reproductive medicine, healthcare technology, academia, and business. Learn from their journeys, study their career paths, ask questions, discover opportunities that may not be visible within the classroom. This video is only the beginning. In future videos, we'll explore more career pathways, professional certifications, international opportunities, research careers, entrepreneurship, and practical strategies for building a successful future as a physiologist. So wherever you are in your journey, Whether you're an aspirant, a student, or a graduate, do not lose hope. Do not underestimate your degree. Do not allow anyone to define your value. Continue growing, develop your skills, and continue believing in your potential. Because physiology is more than a course, it is the science that explains life itself. Thanks for watching. I'll see you in the next video.